Uh, First of all, yeah, thanks, Dr. Kavita, for introducing this session in such a brief and interesting manner. And also, I would like to thank Team iPath, especially Dr. Sanjay, for making me part of such an important deliberation. And so to start with, as being introduced that in the guidelines, we have been addressing certain sections. So role of education system and institution in the mental health of LGBT community is something I'll be focusing on. So let's understand the reality and the possibilities. Uh, I was just, reading a newspaper, The Hindu, and so there was a case which was mentioned that a senior secondary student in a premier school in India expected to be treated with respect and dignity, but found himself the target of jokes, which included his classmates sending pictures of male on male sex acts to the school group, writing explicit messages on his backpack, and so on. He survived the hostility, but it left scars on him that he could overcome only with the great effort and support. And so this was really shocking, but this is not only the one news that I'm talking about. If you open the news section, you will find good amount of news on it and certain alarming facts which made us think that maybe what at school and university level, what we can do and how we can contribute. So there was a study by UNESCO 2018 which mentioned that harassment among LGBT students starts as early in primary schools. Around 60% of the students who identify as LGBT faced bullying in middle or high school, whereas 43% of the students reported to be sexually harassed. However, only 18% of the students report such instances to the authorities, whereas 33% of them drop out of the schools. So the study actually, highlighted that what kind of change is required in our existing system. And this was latest about the study done in October 2020. The suicide rate among trans people in India is around 31%, and almost 50% of the trans population have tried to die by suicide before 20 years of age. And similarly, it was found that people who identify as LGBTQ suffer high rates of depression, anxiety, and substance abuse. So after understanding these facts, and also we know that even though India had been abolished Section 377 2 years ago, the stigma and shame around LGBTQIA community remained widespread. And I got a chance, to ask a few students about it. And the response was again same, that still teenagers were not feeling comfortable in coming out and exploring their sexual identities. Despite this, because again, they require more affirmations from the society in return. So what disrupts mental health? The experience of prejudice, oppression, and discrimination, which is real. Rejection and bullying, often starting from home and school. Homophobic or transphobic bullying is most commonly experienced by young people, which has been reported in various researches, as you can see. Access to education, employment, and social spaces can be limited or intimidating in certain cases. And workplace discrimination, often subtle and indirect, can keep people from fully exploring their capabilities. So these kind of things definitely affect the mental health of the community. And then we can see actually various life phases and how it affects different individuals differently based on the kind of environment the person is giving. So maybe this picture actually depicts, the kind of environment which the person is getting and what kind of mental health the person can develop. So because of these things, psychological concerns are quite genuine. That fear and anxiety related issues about their own identity, being outdated relationships, acceptance and safety is one concern. Mood related issues, including depression and anxiety, is also being reported. Lower sense of self, affecting self-esteem, self-confidence, and impacting performance, achievement, and life satisfaction. Lack of access to quality help, resources, and support that may lead to greater unsafe behavior. And all these things are causing the unconscious erosion of self-worth, means directly affecting the person's psyche and the cognitive ability of the individual. So what as a system we can do? Maybe changing the perception that we also call as nazariya. Why? Because conflicts between one's internal reality regarding gender and the way the world is can be source of major distress. And that's why it is really need to be addressed as soon as possible. It is not that our systems are not doing anything, but again, major changes are still required. And what change can do is that when schools specifically address sexual orientation and gender identity in policies, students are less likely to experience harassment at school, are far more likely to report incidents of harassment when they occur, and are twice as likely to have teacher intervene in incidents of homophobic bullying. So in 2014, as well as in 2016, this research stated that policy changes do make a good effect. So at school level, so maybe most schools in India advocate binary stereotypes that all boys school or all girls, or the term co-education. So making spaces gender neutral at the very least, and if possible, promoting affirmative practices for acknowledging respect, equality of diversity is essential for social reform practice. The normalization of gender variation, right from preschool, school stage to continue into higher education and the workplace. The ability to be mindful of developing a non-binary and inclusive system would include educating teachers, management, as well as administrative staff about the whole concept. Teaching in the school curriculum, topics such as sex education, sexual orientation, gender identity, and gender variation should be included. The presence and visibility of advocates for the child, role models, and supportive adults and peers should collaborate. And the key person, the principal of the school, in dealing with bullying behavior, because he or she provides leadership to both staff and students in developing and implementing a vision of the school where diversity is accepted and respected. So maybe the principal is one of the major person when you talk about school settings, can be part of this major change. So top signs of an LGBTQ friendly college and schools is gender identity, non-discriminatory administrative policies and statements, and affirming clubs and organizations can be one of the things which can be important. Then at university level, abide by the mandatory guidelines given by higher education regulatory bodies such as UGC and NAC regarding gender sensitization, which has really become a very, very important thing to be implemented in all the universities. And along with it include norms related to LGBTQI community, because that is up to, again, the university, what kind of norms they set up further. And create awareness among faculty, staff, students, similar as we were talking about the school settings. And also gender cell, which is nowadays it's mandatory and it should be there. So when we talk about they are there in the paper, so we have to again assure whether it is being practiced or not. And then maybe using media campaigns. Now everything has become digitalized, so why not to use that platform and create awareness by organizing certain workshops or sessions. Include gender sensitization as part of the course curriculum taught, as we were discussing in the schools. And maybe the topics should really focus on the challenges, causes, and needs of LGBTQIA community. And the topics further can be nurture versus nature, social nuances, diversity in sexual orientation, gender identities can be part of this wide spectrum. And believe me, when you ask students who are studying maybe at school or university level, they are really interested in knowing about these facts, because now there is a wave of empowerment. Then at, again, university level, further training workshops, faculty development programs can be organized on large platforms so that a more diverse gender sensitive environment can be promoted. Along with teaching exposure, maybe other reading material such as films or maybe certain other videos, along with guest lectures, people who are working in this field closely can be called and maybe their experience can be discussed. That really will help in creating or bringing this transformation. Empowering each and every one in your system is really very important because it really is a teamwork. So empowering your employees, staff, students at the time of orientation, when they join, as well as in between, and gender sensitization should be part and parcel of each semester. So this is just one picture that we did one awareness campaign on gender equality, one big event on Psychology Day, and we invited one transgender activist, and students, were really happy in understanding the challenges and the issues and what they can do. So these kind of things can really bring change in the mindset. So maybe at the end, living with an identity that's stigmatized across society takes a toll on one's mental well-being. So let's contribute in our ways by adopting few measures so that well-being and emotional health of the community can be taken care of, by making inclusive environment for them where they can feel that they are our new normals. We accept them as they are. And this can only be possible by inclusive policies, which should start with equality laws. Thank you.